The White House COVID-19 test that Donald Trump has been talking up is just another in a line of many treatments and tests he has promoted that have given people false hope, only for them to blow up in his face later on. The Abbott rapid test failed to always detect people who were infected with COVID-19, according to a rival lab. The largest advantage of the Abbott test is that it can work quickly, determining infection or lack thereof within 5 to 13 minutes. The Cepheid diagnostic company found that Abbott missed one-third of the positive diagnoses when both tests were compared using nasopharyngeal swabs. When dry nasal swabs were run on Abbott machines, more than 48% of the positive diagnoses were missed when compared to nasopharyngeal tests with the Cepheid testing platform. Dry nasal swabs are less invasive than the nasopharyngeal swabs that penetrate deep into the nose. While the test is still in its preliminary stage and not yet peer-reviewed, it raises questions of why Trump was praising it so much. He brought it to a press briefing on April 2 and said it created a whole new ballgame. Abbott denied its test was missing so many positive diagnoses. It's unclear if the samples were tested correctly in this study. Abbott has distributed about 1.8 million ID-Now tests, and the reported rate of false negatives to Abbott is at 0.02%, said John Koval, Abbott spokesman. This rate has been previously shared with the FDA. In communications with the users of the test, it is performing as expected. It brings up questions of how many people at the White House have COVID-19. Last week 2 staffers tested positive. It's been said that Trump and Mike Pence are tested every day and that they have been negative. But these could be false negatives. Other customers of Abbott include small physician groups and large retailers such as CVS. They are using the ID-Now test at 5 drive-through testing sites set up in large public parking lots. These include the Georgia Institute of Technology lot in Atlanta, Georgia, and the Twin River Casino lot in Lincoln, Rhode Island. A New York University group initiated the study comparing the Abbott test because it was searching for a diagnostic tool that would provide testing at a faster rate than it currently can. The Abbott ID-Now test was a logical choice, as the results are tested in a device that is toaster-sized between 5 and 13 minutes. Some companies are using testing devices as large as a washing machine and the samples take much longer to analyze. There were questions surrounding the Abbott test even before the NYU study. Francis Collins, the director of the National Institutes of Health, testified before a Senate committee last week that the Abbott test had a 15% false negative rate. This seems to be referring to unpublished data from the Cleveland Clinic. If you're in a circumstance where you really don't want to miss a diagnosis of somebody who's already carrying the virus, you'd like to have something that has a higher sensitivity than that, explained Collins. A study that was published on April 23 in the Journal of Clinical Microbiology shared that the Abbott rapid test missed about 25% of positive diagnoses when compared to a slower Abbott test. Abbott has a variety of reasons for not going along with the results of these studies. The Cleveland Clinic study involved putting the swabs in a no longer recommended liquid, reported Koval. He suggested the samples in the NYU study may not have been run correctly. We are working with the author to better understand the analysis as part of the scientific process, Koval said when discussing the study in the Journal of Clinical Microbiology. Researchers at Loyola University Medical Center found 1 in 4 missed positive cases. Healthcare providers at Loyola are using the Abbott test to screen patients, yet they are also performing a laboratory test to double-check the results. We are going to do some additional testing to investigate our initial results, and we will continue to monitor test performance going forward, said Medical Director Amanda Harrington of Loyola's Clinical Microbiology Laboratory and also an author with the Journal of Clinical Microbiology study. Over at Rush University Medical Center in Chicago, pulmonary and critical care physician and acting chief quality officer Brian D. Stein said the facility didn't have exact numbers, yet it was still enough for them to know that Abbott's test was not quite as sensitive as other tests that take longer to run. He added, "The question is, do we have something better that's that fast? No." Some early users of the Abbott test found the rate of false negatives was too much for them to be useful. Abbott worked with the FDA last month to add new instructions to address how to avoid diluting samples. Regardless of the false negatives, a rapid test can be useful to vet out sick people quickly, even if it doesn't catch them all. The guidance we are giving is that if an ID Now test is negative and the clinical suspicion is high, to run another test to confirm, said physician Bob Kocher, who is also a partner at a venture capital firm and a member of California's testing task force. He noted that the odds of having 2 false negative ID Now tests are low.